Are you waiting for or have recently just had a total knee replacement? If you have, then this video is crucial for your success after the surgery. Hi everybody, my name is Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham, and today I'm going to be revealing the 3 major mistakes that many people make after total knee replacement. Now, before we dive into the content of today's video, please remember to like this video and subscribe to the channel if you haven't already, because then you'll be the first to hear about our new videos when they come out. But let's talk about total knee replacements. And total knee replacement surgeries are usually done for people who have pretty severe arthritis and they've tried physio, they've tried other courses of treatment, and nothing has worked and they're still in pain. Maybe they can't sleep, maybe they can't walk as far as they'd like. So the only option that remains for them is a total knee replacement. And more often than not, these surgeries are really successful. But the success of the total knee replacement surgery often comes down to what you do after the surgery is complete. Okay, so if you don't treat the knee properly after the surgery, you're leaving improvements on the table and you're asking for trouble later down the line. Now, in my job as an over-50s specialist, we see tons of people who've had total knee replacements. We see them both for immediate post-operative rehabilitation, and we also see them later down the line if they have either other injuries or problems with the knee later on, then we help them with that as well. And there are 3 big mistakes that I commonly see people make which don't give their knee replacement the chance of recovering as much as it should. So I'm going to reveal the 3 of them to you today, and we're going to talk about why each one is important. So the first mistake that people make after a total knee replacement is not regaining range of motion quickly enough. Now, when you've had a total knee replacement, what's basically happened is the bottom part of the femur and the top part of the tibia has been replaced. So it's major surgery. It involves cutting off the top or the bottom of these bones that make up the knee. And then after they've been cut off, a titanium, usually titanium replacement, will be put on. Because this is such a major surgery, after you come out of the surgery, your body will very quickly start to put down a tissue around the knee called scar tissue. And this scar tissue is a big part of what causes knee replacement stiffness after surgery. Now, you can't stop the body from putting down scar tissue, but you can decide how you respond to it. So when there's a lot of scar tissue, what people tend to find is that they have trouble flexing the knee, and they also have trouble extending the knee, so straightening it. So both movements tend to be stiff after surgery. Now, some people will think, well, if we just leave the knee to get better, then the stiffness will improve on its own. And unfortunately, that is not the case. If you don't work on the stiffness of your knee, it's going to stay stiff, possibly indefinitely. Now, the other thing that people don't tend to realize is the fact that you have a window of opportunity after a total knee replacement with which to get your movement back. And if you haven't regained your movement within this window, it's going to be very tricky to do so. So the key first window after total knee replacement surgery is the first 12 weeks. So you must be doing everything you can to regain your flexion and extension in that first 12-week period. Now, further improvements can be gained in the 3 months after that as well. So for the first 6 months after a knee replacement, you can regain range of motion, but that second 3 months tends to happen more slowly and it tends to be harder work. So the quicker you regain it, the better it's going to be. Now, I aim for most of my patients to have at least 120 degrees of knee flexion, which is about that, I would say. So that is about the angle of the knee that we look for, and I would like them to have less than 10 degrees short of full extension. Now, some people can't extend past or can't get to 0 anyway, even with their normal knee, which is fine. So that's why we give people a bit of a range to aim for. Ideally, we want to be getting that knee bend and straighten close to what you have on the good side. So that's the first mistake that many people make. Now, the second mistake that many people make after a total knee replacement is thinking that the strength will come back on its own. So when you've had a total knee replacement, as we discussed, it's a major surgery and the body almost goes into shock. The brain will not allow you for the first few weeks after your surgery to use your muscles around the knee as much as you possibly could before. Now, what will happen over time is that you will regain the ability to use those muscles. After the pain settles down and the knee starts to move better, you will get that strength back to an extent. That will allow you to walk, that will allow you to do all your normal daily tasks. But if we were to measure the strength before and after, we'd find that there's a huge difference even after the pain's gone away. So even with that brief sort of 2 to 3 week period when the muscles aren't working well, muscle wastage happens at a very alarming rate. We'll lose muscles in the thigh and muscles in the hips incredibly quickly if we're not careful. So one of the key goals of having treatment after a total knee replacement is to regain that strength, even when you feel like you can walk. Because if you don't regain the strength, the knee joint has no protection and it's at higher risk of breaking down later down the line. So regaining strength in your thigh muscles and in your hip muscles is absolutely vital if you want to make the most out of your knee replacement. Now, the third mistake that people make, and I see this all the time, is that they don't stretch the calf muscle after their total knee replacement. Now, this is a shocking mistake, and the reason it's shocking is because I see tons of exercise programs that my patients have had provided by other physiotherapists, and quite often they completely neglect stretching the calves. And the calves are such an important muscle group when it comes to knee health. They're so underrated in terms of the effect or the magnitude of the effect they have on the knee. And after knee replacement, they get incredibly tight. So just to clarify what we're talking about, the calves are the area at the back of your shin, so your lower leg, and you can feel them work if you stand on your tiptoes. They're the ones down here in the lower leg. Now, the calf doesn't actually stop at the top of the shin. It stops above the tibia. It actually attaches to your thigh bone. So if the calf becomes tight, okay, bearing in mind it starts at the heel and ends at the thigh, it will compress everything between it. And what's between your calf? Your knee joint. So if your calf is tight, it compresses the knee joint and it can cause pain and stiffness. Now, after a total knee replacement, because of a period of lay-up in your bed, you'll probably spend 2 weeks not weight-bearing as you normally do. That's enough time for the calves to get incredibly tight. And if they're tight, it can restrict movement, it can cause pain after a total knee replacement, and it can stop you getting better as quickly as you should. So you must have some way of stretching the calves. I have lots of other videos on my channel about stretching the calves. I will leave a link to one of them below this video, and you can see an excellent calf stretch that's suitable for most people. So those are the mistakes that people make after total knee replacement. Obviously there's other mistakes too, but those are the 3 biggest ones that people don't pay enough attention to. So the first one is not regaining range of motion quick enough. The second one is thinking that the strength will come back on its own. It won't. And the third is not stretching the calves after total knee replacement. Anyway, I hope you found this video useful. If you have, please leave me a comment below because I really appreciate reading your thoughts. And if you haven't already, please feel free to pick up a copy of my book for more tips like this. It's called Thriving Beyond 50 and you can find it on Amazon using the link below this video. Anyway, that's all I've got for you today. Thank you very much. I really appreciate your time and I look forward to speaking to you on the next video.